Have you ever been in so much pain that you could just feel the knot and the thought crossed your mind about getting some anesthetic, just injecting that part? Maybe you have a knot in your back and you just want to get some of that lidocaine and numb the entire area. Well, Dr. Junek actually does this with trigger point injections. I was able to work with her and see her do this along with acupuncture. And if you stay tuned till the end, she's going to tell you a lot about her MSK clinic, why she does it, and why it's beneficial to patients. All right, so today I'm shadowing a really cool physician. The story of how I met him is interesting. I was searching online for a doctor who has a metabolic health clinic here in Canada. Found one here in Ottawa, so I called the clinic, asked to meet with him for an hour, and he agreed back in January of this year. Ever since then, I've been kind of emailing him. We're thinking of ways that I could potentially shadow him because he just isn't one of the doctors that is associated with the hospital and school. I invited him over for dinner. We ate steak. I chatted about the business, how he got his training, and just really what he does for his patients, connected there. And now that I'm on my integrative medicine week, I was able to arrange a 2 days of shadowing and working with him. So I'm gonna go work with him today. I'm excited for it, to see in person how he talks with his patients, how he works with nutritionists, and how the whole clinic is set up. So that's the plan for today. Let's see how it goes. So Dr. Bishop has this body impedance scale that measures my weight, body fat percentage, and muscle mass as well. And he was nice enough to let me try it. Now the thing is, I can't show you all the results because it's on this crumpled piece of paper. So what I did is I just wrote it down, and I'll tell you the numbers and have the numbers show up on the screen. My weight on this day was 186.5 pounds, but I know that I normally weigh in the morning about 181. My lean body mass is 148.6 pounds. My body fat mass is 37.91 pounds. And then my body fat percentage is 20.4, which isn't too bad, but ideally I do want to bring it down into the teens, maybe around 15% or so. And then the machine also analyzed the muscle mass in each of my limbs. So this is what's interesting. My right arm weighs 8.02 pounds and my left arm weighs 8.22 pounds, which is odd considering I'm right-handed. I would think that I have more muscle on the right side, but doesn't really matter. It's just a fun fact. Now the thing is that these machines aren't typically 100% accurate, but what's important is that if there's a trend, if your body fat percentage trends downwards, then that tells you something. If it trends upwards, it tells you something and gives you further tips on how to, or clues that you should be changing your diet or management of whatever outcome you're trying to measure. So in summary, I'm not in bad shape. These results are great. And if we take into consideration in the previous video, my VO2 max being in good condition for my age, doing well, but there are rooms for improvement. Highly recommend doing these tests if you get the opportunity to do it. During this week, I was also able to shadow a naturopath for 2 days, and I typically sat in on the patient meetings that were 30 to 45 minutes long. If it was a new consultation, it'd be an hour long. And it was very interesting to see how the history is taken and also the different treatments for certain conditions. It was nice to see that if a conventional medicine approach didn't help, then you have the naturopathic ones, and also they can work together to give the patient an optimal treatment plan. All right, so this is the next day, second day I'm working with Dr. Bishop. I'm supposed to be here at 12, but I asked to come in a little bit early because I want to shadow the nutritionist, because the way it works is that for most of the patients, the nutritionist sees the patient, the doctor pops in and wraps things up. And so you like your job when you want to go in earlier. I'm really excited to be here. Wish I could be here for a month or more to learn everything and how the clinic works. So I'm going to go in right now, and then Dr. Bishop will arrive around 12 and we'll start seeing patients. All right, so I have a shift with the naturopath today. It's Saturday, here for 7:30 a.m., which is kind of, and I think it'll be a half day, maybe a full day. I'm hoping it'll be shorter, that way I can go home and relax, see the dog, and work on my residency applications. All right, hey guys, I'm here with Dr. Junek again, but this time at her MSK clinic that I've shadowed her last week and then today as well. I'm gonna flip the camera and let her talk about what she does here. She does some trigger point injections and acupuncture, but she can tell us a lot more about it.
Perfect. So, hi, I'm Dr. Junek, and I sort of fell into this practice when I retired from emergency medicine. My buddy, who's the owner of the clinic, kept telling me how awesome it would be to have an MD come and do some of these types of therapies because he sees so much great results with the acupuncture. And so I just had the opportunity to learn trigger point injections and acupuncture at around the same time. And I've come here and worked at this clinic, and it's been really, really eye-opening to see the kind of results that we can get with patients. So I'm really pleased to be able to tell you about it. So basically, trigger point injections are when we inject local anesthetic. This one here is a mix of bupivacaine and lidocaine, a 9-to-1 ratio. So that's a little bit longer acting typically. And we inject this into areas of the muscle that are really tense or tight or not moving properly. And we think that the action of the trigger point injection is not so much the effect of the anesthetic, which turns off nervous signals for 20 minutes or maybe 2 hours, but actually more the effect of injecting liquid into the tense muscle that's so tight that it just doesn't want to let go of until you open it up from the inside. So I see that the injections can be really helpful for managing musculoskeletal pain and dysfunction that isn't always responsive to the manual therapies. Of course, when you're not responding to conservative therapy, you want to kind of re-question the diagnosis. But when people are still tense and tight and they're not being able to move and they just need something more intense for therapy, this is a really way to kind of up the ante on the intensity of your treatment results. It's unfortunate though because OHIP only covers about 3 injections and they don't really pay very much to do it. So there's very few doctors that are actually motivated to learn how to use this really, really awesome skill. You'll see pain physicians doing it, but they tend to deal with people who have chronic, complex pain, and it takes a year or 2 to wait to get and see one of them. And you'll see some emerge docs do it, but that's really just hit and miss if you get them in the emerge or not for your painful condition that you present with. So we offer a unique service here at our clinic where we have ability for patients to book in usually within a week or 2 to see somebody for an assessment and see if this is something that could be helpful for their condition. And the other thing they do is called neurofunctional acupuncture. So neurofunctional means we're trying to modify the function of the nerves and the muscles that they control. And acupuncture means the same thing that you would think it does. It means small, tiny needles, the same needles that we use in traditional Chinese medicine. And so what we do is we insert these at special sites in the body, whether it's a point in a muscle, whether it's at a nerve branch, whether it's at an intersection of the two, whether it's into ligamentous tissue, and we apply a little bit of electrical stimulation. One of these fancy guys. And so we've got 3 units here, so we can control 3 pairs of leads, so there's 6 leads here in total. And we add a gentle electrical stimulus, which gives a bit of a pulsating signal. And what that pulsation does is it helps normalize the nervous system input going into that area, kind of acting as a bit of a reset to tell the nerves to innervate that area properly and to potentially contract and turn on muscles that have been inhibited by functional inhibition, which I'll tell you about in a second as I finish up, because that's where I would say we have the strongest indication for the acupuncture. While this is also a really, really great treatment, just like the trigger point injections for areas that aren't responding very well to manual therapies, I find this is a great technique to reawaken areas that have been inhibited by an injury. We saw a patient earlier today who injured his leg and maybe has something in his hip, and now when he goes to walk, he feels like he's gonna fall because he can't put weight on his leg. And what happens is when we injure an area, our brain receives that pain input and it says, oh, it hurts when I move this area. So what the brain does is it says, well, I'm just gonna turn off making that area move because then it won't hurt anymore. And so your brain unconsciously, your brain and spinal cord unconsciously start turning off that muscular area, and then you lose the strength. And so when you go to walk, you feel like you're gonna fall over. So the acupuncture input can help reawaken that nervous system change and reset it so that it goes back to working normally again. Now, that's not to say that that happens in everybody, and there are other ways to bring that back online, like with rehabilitative exercises and manual therapy. But as I mentioned with the trigger point injection, sometimes one technique doesn't always work for the right person. So these are really cool tools that I can bring in as an MD compared to the typical physio, chiro, massage, osteopath, athletic therapy, and the other treatments that we use for musculoskeletal injuries.